Well, hey guys. So Differin came out with a new product that somebody on my Instagram brought to my attention, so thank you so much. And I'm going to be reviewing it today. It's their new resurfacing scar gel. This is a product that is marketed to people with acne that heals with scarring. And so before I get into the ingredients, I just want to clarify a few pointers on acne scarring, because I think it's an area where people get confused and it's easy to be misled and then ultimately disappointed. When it comes to healing acne, there are a few things that people will call acne scars. The first is post-inflammatory hyperpigmentation. Basically, after the acne heals, you're left with a dark mark, or even while the acne is healing, you'll notice discoloration and a dark mark. Now that will go away on its own, albeit very, very slowly, with two things: aggressive sun protection and resolution of the inflammatory issue, which in this case is acne. So long as the acne is controlled and you're protecting it like a champ from the sun, it will fade on its own. There are ingredients that can enhance the rate, increase the rate of clearance of the post-inflammatory hyperpigmentation, some of which are in this. But I want to make it clear, post-inflammatory hyperpigmentation is not a true scar. You can have acne, though, that does heal with a true scar. The first type of set of scars that you can get, for which this product will address potentially, are thickened scars. These are called hypertrophic scars. Basically, if you look to the side of the lesion, you can see that it's elevated. It's raised, it's thickened. It may have a shiny appearance as well. Or another type of thickened, raised scar is called a keloid, and that is something that black people actually are at higher risk for. For whatever reason, they tend to develop this type of scarring, uniquely so. And it actually will, the difference between a keloid scar and a hypertrophic scar is that the keloid scar will actually extend beyond the margins of the original lesion. So it will go outside of those margins and is more stubborn and resistant to any type of treatment than a hypertrophic scar. But anyways, those are the two types of kind of thickened, raised scars. But then more commonly what you have, because acne is a process that starts down kind of deep in the skin, you have scars that heal with a divot. There are atrophic scars, ice pick scars, rolling scars, boxcar scars. These types of scars, not really going to be addressed by, honestly, any topical. Yes, long-term consistent use of a topical retinol with time may help to improve the appearance of those types of scars, but by and large, it's going to be procedural based, whether it be a resurfacing laser, filler, TCA cross. I have videos on these procedures and these types of scars, so check those out. But if you have those types of scars, I would just set your expectations going in that a product like this, it's not going to fill those in at all. It may modestly improve the appearance of them, but it's not really going to change those. So I want to set I want to make that clear from the get-go about what you might expect. Another issue that people also deal with when acne heals is post-acne redness. Some of the blood vessels in the skin, they get so riled up, kind of enlarged and dilated due to the inflammation of the acne, that once the acne goes away, they're kind of still there. There's a lot of inflammation and there is redness. Like post-inflammatory hyperpigmentation, that will fade, albeit very slowly, with time, so long as the acne is no longer active and the person is protecting their skin from the sun and from things that cause irritation that can aggravate that redness even further. This product might help with that a little bit. All right, so those are the different types of acne scars. This product has some great ingredients that are pretty evidence-based for helping scars. It has silicones in it as the first few ingredients. Silicones applied topically to the skin have been shown to improve the cosmetic appearance of scars. They are an evidence-based, whether it be a silicone scar gel or a silicone sheet that you put on over. I've talked about these in other videos. Like I love the Scar Away silicone sheets. Anyways, those silicones and silicone sheets, basically they help hydrate up the scar, and they reduce frictional forces on the skin that otherwise would contribute to further thickening. So they can smooth out the scar, and they can reduce redness related to thickened, raised keloid scars. They work best if applied early on and kind of on a continual basis. So right as at the time of healing. They're most well studied in the setting of post-surgical wounds, where we kind of have control over that, right? Like the patient, you do a procedure once the initial healing, once the skin has initially healed over, and you can start a silicone-based treatment for the future scar. And we have good evidence that in that fashion and with that type of intervention, ultimately you can get a better appearing scar. And some of that is extended onto acne, but a lot of people find out about this once they already have a substantial acne scar that's been there for a while. The silicones can help, but I wouldn't expect a miracle. The other ingredient in this, which we also have evidence is helpful for improving the cosmetic appearance of a scar, is centella. Centella is a botanic ingredient that is anti-inflammatory and has been shown to help with healing and ultimately help the cosmetic appearance of the scar. It has that. It also has sea buckthorn oil in it, which I've talked about in other videos. Sea buckthorn is rich in fatty acids that help with the skin barrier. It has antioxidants that are going to be anti-inflammatory. It's actually a really good ingredient in skincare products. So I'm kind of excited because that seems like a bit of an unconventional ingredient for a company like Galderma to put into something. And it also has Boccuccio, which is kind of what they promote in this. I have a video all about Boccuccio. Boccuccio is a monoterpene that is extracted from plants, and it's been shown in laboratory-based assays to have anti-proliferative effects, antioxidant effects. It's thought to act similar to retinols, and it's of interest because in clinical studies, although they're small, in the short term at least, it seems that Boccuccio, in contrast to retinol, is much less irritating for patients and potentially is something that's easier to tolerate. Now, when you're thinking about things like post-inflammatory hyperpigmentation, post-acne redness, the last thing you want is something that is irritating, that can actually aggravate those issues. It's not really conducive to healing off the bat. So this is, potentially an alternative. However, we really don't have a lot of data to support that Boccuccio acts like a retinol in the true sense of boosting up collagen production in the deeper layers of the skin, which are things you really want from when you're thinking about improving scar appearance. You really want that deeper component. And whether or not Boccuccio does that, we really don't know. So we really don't know. There was a recent small study that looked at Boccuccio versus retinol for improving some of the visible signs of photoaging, and they did show improvement in wrinkles and fine lines and hyperpigmentation using Boccuccio, similar to retinol, but they didn't have any markers of changes going on in the deeper layer of the skin, and it was a really, really small study. So I'm not saying it's impossible that Boccuccio will help these things. I would just like to see more data. Now, they do always bring up the fact that Boccuccio is potentially a less irritating alternative to retinol. However, it seems as though it has emerged as a potential contact allergen. So with time, you might actually develop a contact dermatitis to the Boccuccio. We do see cases of contact dermatitis to Boccuccio. So it's not actually completely, safe or without risk. Remember, a lot of these trials and studies that show the benefits, they're looking in the short term. They're not looking long term. So I bring that up because it's something to be aware of. And this also has roseseed oil in it, which there is some interest in that as a wound healing ingredient, but it hasn't really been heavily researched. Rosehip and roseseed oil, they are rich in antioxidants and anti-inflammatory compounds that in theory could support healing. The product itself is actually really nice. It instructs you to use it twice a day, and I do think that's a good way to use it. It absorbs very quickly. It doesn't pill or ball. You could apply this to your face as a moisturizer. It's not irritating or anything, and so you could put it on after cleansing, after you rinse your skin. You could put it on right away to damp skin if you wanted to really seal in transepidermal water loss and really help with hydration and increase the uptake of those potentially active ingredients into the skin. You could apply it just to the areas of scarring, which I think would be a more cost-effective way of using this. If you have an area on your face that is more of concern versus globally, but you certainly can apply it to the entire face as well. The reason I say you might just want to focus it to the area of concern though is that this 1 ounce bottle is $20. That's not too expensive, but I think if you're going to be using it all over the face as a facial moisturizer, you will go through this fairly quickly. Could you use this in combination with adapalene? You absolutely can. It's absolutely fine to combine this with adapalene or any over-the-counter retinol or a prescription tretinoin or retinoic acid, prescription tazarotene. If you're using topical retinol, you can combine these two. For a drugstore product, I think that this is something that is kind of flying under the radar in terms of hot ingredients and ingredients that are of interest to consumers. It tilts more on the natural spectrum of things. I imagine Galderma is wanting to kind of appeal to consumer demand for more natural products. So I actually really like this product, aside from the fact that I do caution you guys about the Boccuccio. You know, that is something that people are developing contact dermatitis to. It doesn't make it the devil or anything, and you always can develop contact dermatitis to anything, but I do point that out because, you know, a lot of people say that it's less irritating than retinol, but down the road, it may not be. It may be more of an issue than people are letting on. Post-inflammatory hyperpigmentation, post-acne redness, thickened scars, hypertrophic scars. Give it 6 months and then you might actually see a little bit of improvement. So that's what I think you can expect. If you have atrophic scars or pockmark scars, ice pick scars, I don't think you're gonna appreciate any noticeable difference other than maybe just the silicones in this will smooth out kind of some of those edges and blunt things. Almost like a pore blurring effect. You can always get that with a silicone-based product. You can combine this with pretty much any active ingredient that you wanted to, in theory, as a moisturizer or, you know, just to the area of concern. But as with anything, the more things that you combine and use, the greater the likelihood of irritation. So to be cautious, it's always a good idea to do a small test area to make sure that you don't have any irritation to the product before moving forward. But overall, I like this product, and I think it's good that they came out with something because there is a lot of consumer demand and interest, rightfully so, in products that address acne scars. Everything, you know, it's interesting, everything on the market 5 or 6 years ago was all geared towards actives for active acne, but nothing has it really openly addressed post-acne issues and the cosmetic issues of healed acne that has resolved and is no longer active. There has been a lack of products that address post-acne skin changes, the cosmetic changes related to post-acne healing, redness, hyperpigmentation, scarring. I'm glad to see that more companies are filling in this void. It is much needed, and I know there is a lot of consumer demand for products like this. Comment below, and if any of you guys have gotten this, tried it. So if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.